Hello, my name is Dunia Gibson, and I'm going to be conducting my head-to-toe assessment today. Now, before we begin, I got Mr. Troy height and weight, also his vital signs, and I checked his vision on the Snelling chart, his visual acuity, and he's at a 20/20. Hello, Troy, how are you?
All right, nice to meet you.
Can you give me your date of birth, please?
December 31st, 1963.
Thank you. And what is today's date?
Today is the 5th
Okay.
of August.
5th of August. Thank you very much. Okay, I'm just going to begin by assessing Troy's skin. Okay. I don't see any rashes, any open lesions, there's no molds. See your fingers. Capillary refills less than 2 seconds. I'm going to assess his feet. I'm just going to move this camera down a little bit. Assessing his skin, there's no pitting edema noted. I don't see any open sores on the feet. Okay, thank you, Troy. Next thing we're gonna look for, I'm gonna assess Troy's head and his skull. Okay, Troy?
Okay.
Alright, just feeling around. I'm gonna check his frontal sinuses. His facial sinuses, frontal, maxillary. Do you have any pain there, Troy?
No.
Okay. Now I'm gonna go down to the neck area. Just lift up your neck. Let me look. Okay, you can put it down. Okay, Troy. Now I'm gonna feel for your lymph nodes. Okay. Pre-auricular, auricular, occipital, submandibular, submental, tonsillar. You okay? Is there any pain?
No.
Okay. Now I'm going to go down to the clavicle. Is there any pain?
No.
No pain. Okay. All right, Troy. Now I'm going to assess for your thyroid gland. I'm going to give you this word. I'm going to ask you to put some in your mouth.
Okay.
Don't swallow until I tell you to. While Troy swallows the word, I'm going to be assessing, palpating his neck. I'm going to be feeling for trachea placement and also thyroid. Okay, go ahead and swallow. Okay, thank you. All right, next thing I'm going to do, I'm going to go down to the eyes. I'm going to begin my neurological exam. I'm going to start by checking cranial nerve number 2. Okay, Troy, just look at me. Look at my nose. Let me know when you see my fingers. Say yes. Okay?
Yes. 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 Yes.
Okay, cranial nerve number 2 is intact. I was checking for peripheral acuity. Next cranial nerve I'm going to be checking for is cranial nerve number 3, 4, and 6. That's the extraocular movement. Now, Troy, just look at my nose and just follow my fingers, but don't move your head, okay?
Okay.
All right, thank you. Cranial nerve number 3, 4, and 6 is intact. Next cranial nerve I'm going to be assessing for is cranial nerve number 5, sensory. Okay, close your eyes and let me know when you feel me touch your face, okay?
Okay. Yes. 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 Yes.
Cranial nerve number 5 is intact. Next cranial nerve I'm going to be checking for is cranial nerve number 7, and that's our facial nerves. Okay, so I'm going to ask you to give me a big smile. Okay, frown, puff your cheeks, wiggle your forehead. Can you do it? Okay, good. And raise your eyebrows. Okay, great. Thank you. Facial nerves is intact. Next cranial nerve I'm going to be checking for is cranial nerve number 9 and 10. Okay. Open your mouth. Okay, gag reflex. I'm sorry about that, Troy. I should have told you. I'm checking for his gag reflex. Okay, say ah.
Ah.
Okay, thank you. Okay, gag reflex is intact. Next cranial nerve I'm going to be assessing for, I'm going to be checking for cranial nerve number 11. That's facial strength and also shoulder strength. Joy, don't let me push against your shoulders. Okay, good. All right, don't let me push your face. Okay, good. Cranial nerve number 12. Stick your tongue out. Wave it side to side. Okay, great. Thank you. Okay, now next thing I'm going to do, I'm going to ask you to close your eyes.
Okay.
Okay, we're going to be checking cranial nerve number 1. Okay, cranial nerve number 1 will be assessing for sense of smell. Just close your eyes. I'm going to put something to your nose. Let me know what you smell. Tell me what you smell.
Alcohol wipes.
Alcohol wipes. Cranial nerve number 1 is intact. Okay, now I'm going to go ahead and continue with my visual assessment. Okay, look down. Look up, please. Okay, sclera is white. The conjunctiva is nice and pink. Okay, like I said before we begin, I checked Troy's visual acuity on the Snelling chart, and he was a 20/20. Now I'm gonna go down and check for Perla. Now, because the room will get so dark when I turn the light off, I'm just gonna go ahead and do the Perla without turning the light off. Okay, Troy. I want you to just look straight ahead, okay? Look at this way straight. I'm sorry, just turn so the camera can see us. Right, look down and just straight. Okay, thank you. No, go just look straight. Thank you. Choice, people did react to light. Okay. I'm gonna ask you to follow, just look at this. Okay. Choice, people did react to light and accommodation. Now I'm gonna finish my ophthalmology exam. Okay, Troy, now I'm gonna come close to you. I just gonna assess your eye, okay?
Okay.
All right, come down closer. Okay, look straight ahead. Look at the camera, I can see. Okay, I'm checking the eyes. I don't see any hemorrhages. There's no neurovascular damages. I'm gonna move on to the other eye. Come down a little bit, sorry. Look up. No hemorrhages, no neurovascular damages. Thank you. Okay, I'm gonna put this down and just feel the sclera. Is there any pain here?
No.
Okay, there's no pain. Good job. Okay, next test I'm gonna conduct will be the hearing. Okay, that's gonna be assessing for cranial nerve number 8. Okay, Troy, now I'm gonna do a whisper test.
Okay.
Okay, I'm gonna tell you 3 words. When you hear me say those words, just repeat them to me, okay?
Okay.
1, 2, 3.
1, 2, 3.
Thank you.
4, 5, 6.
Great, wonderful. I'm just gonna feel around for your ear. Is there any tenderness, any pain there?
No.
Okay. Gonna be doing a rubber and a wine test. Just let me know when you feel it and what you feel in what ear you feel it in.
Okay. Yes. My left ear.
Left ear, okay.
Yes. 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 Yes.
Okay, thank you. Okay, now I'm gonna do my otoscope exam. Sorry. Oops. Okay, gonna be assessing the tympanic membrane. Okay, come closer, please. Okay, it's tympanic membrane. It's pearly. It's shiny. See a little bit of cerumen. Is there any pain there?
No.
Okay. To the next ear. Same thing. The tympanic membrane is pearly. It's a little shiny, and I see some cerumen and hair. There's no liquid in there. There's no sign of an infection. Okay. Now I'm gonna assess Troy's mouth before his nares. Just gonna look in. You know what, before we do that, Troy, just I'm gonna check for patency. Just hold one nostril and breathe in and out. Okay, next one. Wonderful. I'm just gonna look in. Okay. All right, open your mouth. Lift up your tongue. Okay. Okay, I'm gonna put my gloves on. Gonna be assessing Troy's lips, also his buccal mucosa, his gums. Open your mouth. Lift up your tongue. Down. Soft palate is intact. I don't see any lesions or any open wounds in the patient's mouth. Okay. Now we're gonna move on to the cardiovascular, the chest and the lung assessment. Okay, Troy. I'm looking at the patient's chest. I don't see any labored breathing. He's not having any difficulties. But I'm gonna start my exam in the back. Okay, I'm just gonna feel your spine. Do you have any pain there?
No.
No tenderness. Okay, I'm gonna percuss for respiratory. Just sit up a little bit. All right, this way. I'm gonna percuss for respiratory, thoracic. I'm sorry, thoracic excursion. Now, Troy, I'm going to be checking for tactile firmness. I'm going to ask you to say 99 when you feel me touch your back.
99, 99, 99.
Thank you. Now I'm also going to listen to the lungs. Deep breath. Let it out. 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 Thank you. Okay, just turn straight. Now I'm going to finish my assessment in the front. Okay, gonna percuss. Okay. Say 99.
99, 99, 99.
Thank you. Now I'm gonna listen. Deep breath. Let it out. 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 Okay, that concludes our respiratory exam. Now I'm going to move on to cardiovascular. Before I begin that, I'm just going to look at Troy's neck. It just inspect for any jugular vein distension, which I don't see. And I'm also going to go ahead and listen to the carotid arteries. There's no bruits noted. I'm gonna feel for the patient's radial pulses. Okay, now I'm gonna listen to the cardiovascular sounds with him sitting up, and I'm gonna finish my assessment with Troy laying down. Aortic, pulmonic, tricuspid, and mitral. Okay, Troy, just lay back for a second. Aortic, pulmonic, tricuspid, and mitral. I'm gonna feel the patient precordium and also feel for the PMI. So it'll be fifth intercostal space, mid-axillary line to feel for the precordium. Okay, thank you, Troy. All right, so now I'm gonna lay the head of the bed down and bring the camera closer. Let me just do your feet. Okay, I'll lay that down. Make you comfortable. Lay that down, and then I'm gonna start the abdominal assessment. Leave that. Okay, I'm gonna listen to bowel sounds. I'm also gonna listen to the renal arteries. Okay, now I'm gonna look for rebound tenderness. I'm gonna begin at McBurney's point and just feel that area. And if there's any pain in that area, it will be indicative of appendicitis. Troy, do you have any pain there?
No.
Okay. Now I'm gonna go ahead and feel for the spleen. Feel for the spleen and the liver. I'm gonna begin on the left side and work my way here. Do you feel any pain there?
No.
Okay. Feeling for the liver. Okay, now I'm gonna assess for the liver span. Gonna measure. The liver span is always between 6 to 12 centimeters. Troy liver span is at 7 centimeters. Thank you, Troy. Okay, you can sit up. I'm gonna complete. I did most of my neurovascular checks when I first started the exam. Now I'm gonna do the deep tendon reflexes and also assess for Babinski. Okay. I'm going to check Troy's biceps, his triceps, his knees, and his ankles. Thank you, Troy. We're going to start with your biceps. Just bend your elbow. Okay. So the knees. Put this camera down. Okay. Okay, thank you. Now I'm gonna go ahead and assess for the Babinski, and I'm gonna be looking for any sign of diabetic neuropathy. Okay. While I'm here, I'm also gonna check Troy's pulses in his feet. I'm gonna check for the tibialis. Okay, then the dorsalis pedis. There's no edema in the legs. All right. Gonna be checking for vibration as well. Troy, close your eyes and let me know when you feel any vibration on your legs.
Yes. Yes.
Okay. Also, let me know when you feel sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. Dull.
Thank you, Troy. I'm gonna continue checking for Troy's coordination. Troy, I just want you, I'm gonna push this back a little bit. Okay, look at me. All right, I want you to do your hand like this. Touch your nose, and I'm gonna ask you to go one finger at a time, and I'm gonna ask you to go faster and faster when you begin. Okay, go ahead and start. Close your eyes. Just checking for coordination. Go a little faster. Okay, great. Thank you. All right, Troy, I'm gonna make a mark in your hand. Just let me know what you feel. Close your eyes.
8.
Okay, wonderful. Now I'm also gonna put something in your hand. Just let me know what it is. Close your eyes.
Corn.
Okay, yes, wonderful. All right, we're not done yet. I'm gonna start my muscular exam. You could come all the way back, Troy. I'll bring the camera close. Sorry. Okay. Troy, I want you to bend your knees. Okay, do from side to side, leg side to side. Okay, let's do the other leg. Side to side, side to side. Thank you. I'm gonna palpate the hips. Is there any pain there?
No.
Okay. Okay, sit up, please. Okay, now I'm gonna check for muscle strength. Okay. But before I do that, Troy, just bend your elbows all the way back. Is there any pain?
No.
Okay, great, thank you. Bring it back. Good, like this. Well, I'm gonna push, don't let me push you. Don't let me pull. Wonderful. Same thing with the legs. Don't let me push. Don't let me pull up. Okay, wonderful. Okay. So now what we're gonna do is I'm gonna ask you to stand up. Be careful. Put this in the back. Okay, Troy. I want you to stand on one leg. Wonderful. Do the next one. That's good. Okay, now close your eyes and put your hands out. Okay, wonderful. Now I'm gonna ask you to walk. You know, I want to make sure you do it in a way where the camera can see you. Okay, walk towards that door. While Troy is walking, I'm assessing his gait. Okay, stop right there. Come back slowly, but come back heel to toe.
Okay.
Heel to toe. That's wonderful. Okay, now I want you to turn around and go back walking on your toes. Thank you. Come back walking on your heels. Okay, that's wonderful. Now, turn around, please. Bend over. I'm gonna be assessing Troy's spine. Okay, that's wonderful. Stand up. Okay, have a seat, please. Do you have any questions for me? Because that concludes our head to toe assessment.
Well, everything was okay.
Thank you very much for
Thank you.
participating.
All right.
I appreciate it.